Good morning to everyone. We are starting today with this COVID-19 conversation series. Our objectives are three. The first one, we want to knowledge transfer some of the best practices that we are seeing when we implement our projects. The second objective of these COVID-19 conversations is to showcase to the UN resident coordinator in every single country, or many of services, what we are doing, what we can do with the UN together at the country level. And the third objective of these COVID-19 conversations is to showcase what we can do with the private sector and civil society. We need your engagement, and we need you to be closer to us so that we can deliver better and more efficiently.
My name is Wamboi Kahara, and I will be your host. This is where we will focus on advancing the debate on COVID-19 challenges and solutions within UNODC's mandate in support of member states in the region. Today, we will be talking to subject matter experts at UNODC and other national experts in the field of drugs and crime. In today's episode, we will be focusing on the methadone challenge for vulnerable people in the member states. We have some exciting speakers lined up for you. We will be talking to Fayzal Sulliman, the head of the Health and Social Development Pillar at UNODC Eastern Africa. We will also be interviewing Job Kandie, who is the head of Licit Control Pharmacy and Poison Board. Next, we will have Catherine Ngugi, who is the head of a division of National AIDS and STI Control Program, or NASCOP, with the Ministry of Health in Kenya. We are extremely grateful to have you all here today. Thank you for joining us. Let me start off with Fayzal. So Fayzal, how is UNODC responding to key populations such as people who inject drugs and those living with HIV and AIDS and other underlying diseases during the COVID-19 pandemic?
Thanks, Wambi, for having me. We responded first by IEC, Information, Education and Communication. So it's important for us to give the information to the end user of the services, and at the same time make sure that they have the right information. So it's information how to protect themselves, how to adopt healthy lifestyles, for example, washing of hands regularly, and how to wash hands effectively. This is also very important. And at the same time, communicate. Communication is an ongoing process. It is important to understand that it is recommended by WHO that we maintain a distance of at least 1 to 1.5 meter between two people. So especially the methadone clinic, congestion is there. But how did we deal with the congestion? We did several things, extending the hours of methadone dispensing, giving services on appointments, staggered timing, opening new facilities for dispensing so that we decongest the main methadone clinic. Very well indeed.
Are there any other challenges posed by COVID-19 pandemic that UNODC is experiencing in terms of dispensing of methadone to clients? And what measures are you certainly undertaking to ensure that there's a continuum of care of a population you serve?
Yeah, that's very important, but here I think I will give you examples in the regions that we cover. It's important to note that the Regional Office for Eastern Africa covers 13 countries in the Eastern African region. So if I take the first country, Mauritius, in Mauritius there has been a complete lockdown to respond to the COVID-19 pandemic. For people who use drugs, they have been issued with a special permit to access services. So these people with their permit, they come in the morning, They take their methadone, of course, respecting social distancing, wearing masks and all this thing, and this is working well in the 18 dispensing facilities in the island of Mauritius. So let me take another example, the Seychelles, which also have methadone dispensing. So they had some issues with the supply of methadone. Due to COVID-19, the consignment was stuck somewhere in UK. So we had to assist through our colleagues at the International Narcotic Control Board to expedite their last consignment of methadone, because you will understand that methadone is a controlled narcotic medicine and it is under total control of the INCB. And hopefully by the end of this month, Seychelles will receive their consignment. In a nutshell, so many things have to be taken care of, right from the supply till the dispensing, and make sure that the aim is to make sure that there is a continuum of care. Nobody stop getting treatment because of an issue in the supply of methadone.
Are there any mitigation strategies that are being undertaken to both service providers like clinicians and service users like clients at the methadone clinics to keep them safe during this period?
I will give you the example of Kenya. We've been supporting the clinics with PPEs, personal protective equipment, and things like commodities like sanitizers, help them with IEC materials and all this thing. But at the same time, we have people living in prisons that used to come on a daily basis to the MAT clinic. This had proved a challenge because the authorities, like in many other countries, they have prohibited visits to the clinic. To facilitate this process of getting methadone to people living in prisons, so we've had a series of discussions and advocacy with the authorities in Kenya. So ultimately, 2 weeks back, they've opened the clinic. So much so that the 15 clients from the prison that was coming to the clinic to take methadone every day will now get their methadone within the prison. These are the few things that we were looking at, but for us, one of the main challenge is, of course, getting take-home dosing to people, again, to decongest the clinic. So this has been still a challenge, but the discussion is on, and hopefully it will be resolved soon.
Thank you, first of all, for having me, Wambui, on this. Regarding the question that I have asked, definitely the Minister of Health, in collaboration with the county government, has a total of 8 MAT clinics countrywide and nearly 6,000 drug and substance users. So during this era of COVID, the National KP Technical Working Group, through the coordination of the National KP program at NASCOP, came up with measures and strategies to ensure that none of their communities, especially the female sex workers, MSM, people who inject drugs and transgender, lacked access to the necessary services that they require. Among the strategies undertaken was provision of methadone for the people who use drugs. The strategies definitely include the use of mobile van to dispense methadone at various designated sites in various counties implementing MAT services, and the vans following a defined route, and they were adhering to the COVID-19 prevention and response directives given by the government. The county government have also made this transition quite smooth, as they organized MAT teams that operate at the MAT clinics to work in shifts, that at no one time do they get to interact with each other, a step that has greatly helped.
Wambui, allow me to welcome you on behalf of Pharmacy and Poisons Board. Recently we came up with guidelines on good distribution practice, which were revised in order to put more emphasis on management of controlled products. This one will aim at ensuring availability of controlled products as well as preventing their diversion into the illicit market.
While maintaining the supply of methadone, what is NASCOP doing to ensure the continuum of care at various points of a service in the country in this lockdown situation?
Okay. First is we have given 2 guidances so far is the Ministry of Health through NASCOP. One of them is ensuring that we do month-to-month dispensing. We are now doing 3 months of the ART and PrEP and other preventive commodities such as condoms and lubricants. Then we have decentralized of MAT services, for example, opening up of Shimoratewa Methadone Clinic. And the other part is now we are using mobile MAT dispensation, which is still underway. We are almost launching it. Then provision and promotion of HIV self-testing kits among the KPs. Then different strategies definitely have been put in place. For example, the online, outreach, mobilization, and service provision, just to ensure that we maintain contact with our beneficiaries, and then support the people living with HIV through their case management. You have several WhatsApp groups, and and phone calls. We're following up on them. Then we are ensuring that during this time we utilize virtual platforms as much as possible to reach out to our clients.
The Ministry of Health through NASCOP, they are looking at methadone mobile dispensing methadone through a mobile van that goes to different spots throughout the day. So then one of the ways of doing that also is to give take-home dosing. So this is being considered. Take-home dosing means they can take for 5 days so that they don't have to attend the clinic every day. And we are giving all technical assistance to national governments so that they can put this mode of dispensing in place. That's a bit of an overall response to how we are doing in Kenya. How did we respond to the pandemic?
How can you elaborate on the importance of IEC materials and how this is being prepared and disseminated in methadone clinics?
There have been information materials, leaflets and pamphlets developed by our HQ in Vienna with the experts, and of course in collaboration with the international network of people who use drugs, because they have also to contribute to that. And now these materials have been shared. It's there, it's in English, and we are also working with the civil society organizations and the county governments to have it translated into Swahili. It's very simple. It's infographics in its design. Then it's very easy to user-friendly, I should say.
Development of KP, COVID, HIV-related IC materials has been a challenge, to ensure that we sensitize the community, and as well as different staff, working within the field to ensure that we keep them at par with what is happening.
Very well. Tell us a little bit more about the monitoring role of NASCOP in ensuring an uninterrupted supply of methadone in the populations that you serve.
NASCOP is working very closely with KEMSA and the Pharmacy and Poisons Board to ensure that we have enough stocks of methadone in the country. The MAT clinics are able to place in their orders together with the buffer stocks to ensure that stock out is not experienced before the next consignment.
Pharmacy and Poisons Board have simplified the import and export process for controlled substances, which for this case includes methadone. We are also in constant communication with NASCOP and KEMSA, where we ensure that the buffer stock of these products. We have also included several medicines that contain controlled substances in the Kenyan essential list. This one will make sure that these products are available Apart from that, we've also allowed appropriately trained and qualified professionals to prescribe, dispense, and administer controlled medicines. We have also regularly provided training to healthcare professionals and other relevant persons, including those who work within the pharmacy, on adequate access to and use of controlled substances for medical and scientific purposes.
It's important for us, it's part of our mandate to monitor whether sufficient amount of medication enters the country. So if there is any problem with that, then we can seek help from different partners so that there is no disruption in the service provision. So it's a monitoring role that we do keep to ensure that the supply is there.
On the final question, how does PPB maintain its control over potential abuse of controlled medication during the pandemic while ensuring adequate supply of pain management?
Recently, we signed an agreement with our stakeholders, the Pharmaceutical Society of Kenya and the Kenya Pharmaceutical Association, which commits their members to sensitize on the good practice while dispensing controlled products. We always do audits of pharmacies and chemists stocking controlled products. We also strengthen surveillance on premises engaged in supply of medicine. Currently, amendments have been done to increase fines and make them more punitive and deter against the offenders. And Wambui, finally, I would also wish to sincerely thank UNODC for their unwavering support, especially on the issues touching on the MAT programs within the country. And Wambui, in collaboration with UNODC, Pharmacy and Poisons Board are also in the final process of finalizing the guidelines to be used within pharmacies located within the MAT facilities.
Many thanks to our guest speakers today, and thank you all for watching. For more information, you can visit our website, and please do follow us on Twitter. Thank you and see you next time.